I'm Anita Sharma, a GP based in Brisbane in Queensland. I think there's been a rapid evolution of consumer diagnostics since the COVID pandemic. People for the first time realized that they could do at-home tests. So we've seen a rapid introduction of such diagnostics, driven largely by consumer demand and technology. So I think because these at-home diagnostic tests offer patients empowerment, control, and convenience. So I think they are really revolutionizing testing of a lot of conditions and illnesses in the community. There is still a role for traditional tests to be performed even after these at-home diagnostic tests. And those situations would be something like in a saliva-based pregnancy testing at home, if there is a doubt because the symptoms don't match the test, we have to confirm it with a traditional test. If it's very early in pregnancy, where the hormone levels in the saliva may not be high enough to be detected by this at-home diagnostic test, we would need to do traditional testing. And of course, then there's a situation, because this is based on saliva collection, there needs to be enough saliva sample. There are some people who have a dry mouth because of their medical conditions, so they cannot actually perform the test. So we would need to do the traditional testing in that situation. And sometimes patients like confirmation. Even after they've got a positive test at home, they come to the doctor and say, can you please confirm that I am pregnant? Because that then starts the whole process of antenatal care and further management of the patient. So there are scenarios where we still need the traditional testing.
My name is Michael Chima. I'm the CEO of CC Supplies. We're a leading Australian distributor of at-home tests. We recently supplied over 60 million saliva COVID tests in the recent pandemic. Thankfully that's behind us, but we are pioneering the way forward for saliva testing in Australia. In a survey conducted by the manufacturer, 68% of females indicated a preference for a saliva test over a urine test. 21% had no opinion, and just 11% would prefer a traditional urine test. So there is evidence to suggest that there is demand for a saliva pregnancy test in Australia. And look, saliva is nothing new in terms of diagnostics. For many years, researchers and scientists have tried to commercialise diagnostics from saliva. After all, there are billions of bacteria, thousands of proteins, and around 30 hormones in our saliva, believe it or not. We have partnered with a manufacturer to create a patented technology to shine a light on those samples, to stabilise the saliva samples, to make a commercial product that is both accurate and reliable, that can be taken at home in under 10 minutes. And this really empowers women for the first time to choose a time and place and with whom they conduct these tests. So we feel it's a real game changer.
The saliva-based diagnostic at-home testing for pregnancy for women is now a real opportunity to take control themselves and actually allow women to test for pregnancy earlier and more easily than having to first visit a doctor. So it's really been a great advancement in women's health diagnostics, and I think it's a really welcome change for our women out there.
Yes, following extensive clinical trials, the test has a sensitivity of 95.16%, so that should give both consumers and clinicians comfort that the test results that they have are very accurate.
Even with the rising tide of consumer self-diagnostic testing, there is still a role for the healthcare practitioner. I guess our role has changed from being the gatekeepers and requesters to perhaps being the interpreters and validators of tests that are driven by the consumer. So we are playing more of a role, I guess, in care planning rather than doing the whole process ourselves. As GPs, we are really the health managers of our patients and need to be abreast a lot of conditions. So almost like we need to know everything about everything. And in order to do so, I think we need to really keep up to date by reading the latest journals, attending some clinical meetings, and really talking to peers, talking to the experts in the field who then give us a kind of a sneak preview into what's coming, what are the new diagnostic tests on the horizon, what are the new diseases that now we can test for. So I think it's a matter of just trying to be aware and being engaged with the medical community and doing continuous medical education.